Improving the patient experience in the NHS. What's the problem? Well, the first problem is quite a practical one. Staff are really busy doing lots of other things and therefore may not have the time to spend setting up and operating an effective patient experience system. Of course, cash is very tight and therefore any solution has to deliver clear value for money. Yet if we're not careful, all we can end up doing is producing piles of data that isn't being used, that doesn't improve the patient experience and doesn't deliver value to the NHS. And these specific problems is what the health feedback system aims to address. So in essence, what you really want to be doing is to make it as simple as possible to engage patients and find out what they think. For this information to be translated into meaningful insight that can help drive the kind of actions that improve the patient experience and make people's job easier rather than more difficult. The key to this working is an effective feedback loop, and let's very briefly look at how the health feedback system does this. First of all, we make it very easy to capture patient feedback, and this is done, for example, via an iPad, a laptop, an email, the web, a call center, text messaging, or even feedback cards. We provide all the ways to capture that information from patients. Very quickly, this is delivered to the appropriate person. Therefore, the data that's delivered is relevant to that particular person's job. This will help make choices that leads to the kind of actions that improve the patient experience and improve efficiency. So as you can see, we've considered the feedback loop in a very practical way to help staff improve the patient experience by using patient feedback more effectively. So let's look at a couple of reports. The first of which is from our EDS solution. Now in this example, very quickly you can see how it's highlighted areas that are underdeveloped, shown in red, and those in which are highly developed and excelling, the areas in yellow. Another report is from the MPS data collection service. Now very quickly we translate very simple data into meaningful reports that can then communicate how well people are doing to both patients and staff. Now the health feedback system itself is a toolbox that's created various solutions. One of those is to collect sequin data. The other is to implement an EDS solution for quality delivery systems. Another one is to, already mentioned, the MPS system, which is probably the simplest, most effective way to drive continuous improvements by simply asking the minimum amount of questions from any particular patient. It's also been used to create 360 staff appraisals and also an alert system where staff can actually offer their views about anything that they're concerned with in a way that keeps their information confidential but leads to the kind of actions that make a difference. So that's a quick tour of the health feedback system. I hope it's been useful. If you would like to ask any questions, please feel free. They're my contact details. I look forward to hearing any questions. Thank you very much.